So they want to come off their birth control right away. So they don't follow specific steps. They're already in this really ill state, potentially diseased state. So they just panic and they say, okay, just take this birth control out of me. 90% of the time, there's going to be these side effects. Something that is not talked about enough, or I believe is not talked about enough, that I have witnessed is not talked about enough, is how to actually prepare a woman's body for coming off of birth control. We're starting to become quite familiar with the side effects of birth control, and a lot of females really want to get off. And in my experience working with these females, a lot of them are in quite a rush to get off because something has insinuated that it is the cause of all their problems. Now, that very well may be correct, but that doesn't mean you should just hop off as fast as you can, because you can actually exacerbate symptoms or create new symptoms by coming off of birth control improperly. So we'll do a quick little video here. I'll kind of break down what are some of the side effects, both of birth control and improperly coming off of birth control, and some steps that we can take. Now, it's a very nuanced subject, but I'm going to try to keep it as simple as possible, not getting too in-depth, getting too technical on things. But it's important to understand that this is going to be in context of the individual that is relatively doing all right. If they have severe immune issues, autoimmune diseases, severe gut health complications, overgrowth, you name it, you're really going to want to address those first before you can implement this protocol that we will discuss, because you might not react very well. And I will kind of explain that when we get there. But starting off, let's look at birth control side effects. So one of them is going to be androgen dominance. So now, most people are not familiar with what androgen dominance is. To simplify that, women who experience things like unwanted facial hair, water retention, swelling, that puffiness, joint pain, irregular cycles, like extreme bleeding, things like that, that could be androgen dominance. Now, this is due to either the birth control being anti-androgen and it's kind of rebounding, or just excessive hormones, things along that nature. There are many variables as to why, or it could just be because what birth control does to the guts that eventually leads to androgen dominance, because a lot of women have been on birth control for quite an extended period of their life. Secondary amenorrhea. So when we're looking at this, it's important to do labs to distinguish whether you are experiencing secondary amenorrhea or if you are a woman that is experiencing polycystic ovarian syndrome. But this is where you're going to miss the cycle for 3 months. That's kind of how you fall into that category. And if you've been that person, you may want to get your labs checked, but it's also important to understand if you're somebody who has been extreme dieting or anything along that nature, then you're probably going to bet that that's what it is. And you just need to eat more food, which we'll talk about after. So weight loss, resistance, and muscle loss. So interestingly enough, although birth control is taking hormones, most of them anyways, you can actually desensitize that. And if you see, I'm going to post a Dutch test up here. This is actually a woman who has been on birth control for quite some time. As you can see, due to the complications that birth control causes with the thyroid and with the gut, she actually has no hormones. And so this is where a lot of her symptoms were coming from. But the root cause is partially the birth control. So we had to pull her off that. When you run Dutch tests like these for women who are on birth control, a huge percentage of them are going to have no hormones because of the reaction of the guts or even just desensitizing the hormone receptors. So ultimately, that's going to lead to things like weight loss, resistance, and muscle loss. You don't have the progesterone and the estrogen for insulin sensitivity, fat digestion, for muscle preservation, strength, things along those natures. And then we're going to look at thyroid complications. So this is a big one. I created a post quite a while ago, had some pretty good traction in terms of what birth control can do to your thyroid. So when we're looking at thyroid complications, we are talking about, because of the gut dysbiosis, malabsorption of nutrients that are heavily involved in the thyroid. But we're also looking at, you have your OAT axis, which is your ovarian, adrenal, thyroid axis, and they're all interconnected. And when those ovaries, that cycle starts to be impacted by birth control, you're going to see an impact on the adrenals, and then you're going to see an impact on the thyroid. So the thyroid is the end result of your metabolism, meaning if you have dysfunctional adrenals, dysfunctional liver, dysfunctional gut, dysfunctional whichever, your thyroid has to pick up the slack, and it can only do so much. So this is why there's such an epidemic of thyroid issues, because a lot of people end up relying on their thyroid and it just taps out. It doesn't work anymore. But the reality is you need to check 9 different panels when it comes to assessing your thyroid. Your doctor will never properly assess your thyroid. I hate to say that, but that is the reality, especially here in Canada. You can pay to have it properly assessed. So if you go check your thyroid hormones, usually doctors only check TSH, and then they'll see whether it's hyper or hypo, most cases hypo. So then they'll give you something like Synthroid or T4 medication. But what's actually most likely happening is 2 major things. Is one, you're not converting that T4, the inactive form, into T3, which is the active form. So that is the issue. So by giving you more T4, you're not even band-aiding an open wound. It's just very minimal effects. That's why nobody sees a lot of progression on thyroid medications. But it's enough to prevent like total extreme fatigue and disease and whatnot, but they definitely don't improve their symptoms. And then you look at reverse T3, which doctors never check. So when you run reverse T3, what that's going to tell you is how much stress you are under. Because when you get under these stressful environments, your body goes, I need to play it safe and conserve energy. So I'm going to convert my T3 to reverse T3. That sits on the nucleus, not allowing T3 to bind. So what happens now is T3 builds up in the blood. The hypothalamus, you got these negative feedback loops. The hypothalamus sees this, says, okay, we have too much T3, so we need to stop producing T4. And then that stimulates the thyroid stimulating hormone to produce less T4, so you get a high reading of your TSH. But unless you check all these readings, we're also talking thyroid binding globulin. Birth control can really increase thyroid binding globulin. So pretty straightforward. It binds to the thyroid hormone, not allowing it to be converted to the active form. So this is where birth control creates a ton of thyroid complications. And then it's just like a whole downward cascade from there. The adrenals get tanked, the gut gets destroyed because of high levels of cortisol, because the less thyroid you have, the more cortisol you're going to run, and the longer cortisol is going to stay in your system, and cortisol is going to damage the gut lining. So this is where we're going to create a lot of gut dysbiosis and malabsorption. So when I say gut dysbiosis, I'm talking low levels of stomach acid, overgrowth of bacteria, parasites, damaged mucosal lining, leaky gut, these kind of symptoms. That is all going to fall under the gut dysbiosis. And then another way that this contributes to the thyroid complications, never mind the stress that it puts on the adrenals, but majority of your thyroid conversion is going to happen in the gut and the liver. So with those being severely compromised, you're not going to get a lot of conversions. You're going to show a very inactive or poor thyroid, we will say, and then ultimately is malabsorption due to everything mentioned previously. I mean, you're going to see a lot of malabsorption of the nutrients heavily involved with the thyroid, and just overall health and well-being, zinc, selenium, and your B vitamins. Super, super important. So when you see women with low levels of iron and low levels of B12, they call you anemic. Reality is you have low stomach acid. Yes, there is bleeding during menstruation, but with the food you're ingesting, unless you're, super low calories, the food you're ingesting, you are not breaking down and assimilating that iron and those B vitamins from that food, which is giving you the anemia. So once again, by supplementing iron, you are just masking a symptom. There's a much bigger issue, an underlying root cause that needs to be addressed. Because sure, if you're really low on iron, you're going to feel better acutely, but those problems are still there. That gut dysbiosis and malabsorption is still there. So those are some of the most common side effects of birth control. They can even lead to things like autoimmune diseases, very dependent on the individual. And I really don't mean to scare anyone. I'm just trying to illustrate why we're doing this, why we're talking about coming off birth control, because it is a pros versus cons. What's worse, having to raise a child, or I mean that in the best way, but ultimately this can destroy a woman's body. And I'm 100% an advocate for male birth control. Unfortunately, they're just not investing a lot of money into the research with male birth control. But if they were to and come up with something for male birth control, there's going to be a lot less side effects for a man than there is a woman. I mean this from a total evolutionary, biological, physiological standpoint. Females were meant to turn calories into babies. So when that system gets compromised, there's going to be consequences, we'll say. This is where we get side effects from. Once again, you educate people of you educate women of these side effects, they become scared. So they want to come off their birth control right away. So they don't follow specific steps. They're already in this really ill state, potentially diseased state. So they just panic and they say, okay, just take this birth control out of me. Sometimes, sure, women do amazing that way. Sometimes they feel much better. Most of the time, like 90% of the time, there's going to be these side effects. And that is because of hormonal rebounds and the gut dysbiosis and malabsorption and such that removing birth control just doesn't correct. It's not going to make it worse, but it's not going to correct it, unfortunately. So once again, though, if we're dealing with major gut dysbiosis, that is a complex topic that is out of the scope of this video. So that's where you need to reach out to someone like myself or someone who's qualified in that area to help fix your gut dysbiosis. I always fix that first, or recommend fixing that first before coming off of birth control, or at least begin to, but I'll get into that. So side effects of coming off improperly. We're looking at immense PMS symptoms. You'll hear that quite a bit. Once again, that could be a hormone rebound. Birth control can lower estrogen. Paradoxical because you're taking estrogen. But as mentioned, the things that it can create can cause desensitization, and you actually have low levels of active estrogen. But what happens is that estrogen starts to increase, and then the gut dysbiosis creates poor clearance of that estrogen, leading into immense PMS symptoms. And that's where you get a lot of crying. Like a lot of women will cry off their cycle and just not know who they are kind of thing. That is one thing that could be occurring. The same with androgen dominance. I should have put that in here. Well, it kind of is. I'll explain that in a second. But that androgen dominance is a big side effect too. There's a lot of women who have succumbed to polycystic ovarian syndrome from improperly removing their birth control. So this is why we really want to make sure we're doing it properly. Multiple cycles. I'm sure you've heard of many women or yourself have experienced having multiple cycles after coming off birth control. That's because hormones just all over the place. Follicular stimulating hormone, luteinizing hormone, low levels of progesterone, things like that. Especially pulling birth control if you were on a progesterone-based, like higher birth control, that was your reliant. So you'll have women that feel like garbage and they have symptoms, so the doctors give them birth control, and then those symptoms get better. So they become very biased, but then over time, they begin to feel worse. But because birth control initially made them feel so well, they're really biased to that and they don't want to admit that it's the birth control. Plus, you know, in today's society, a lot of women don't want babies. But if you're experiencing these, it's probably from your birth control. But you can have multiple cycles. Once again, flux of hormones. Weight gain, water retention. I will explain a little more on the weight gain, what happens there when we get into the protocol. And then due to the potential androgen rebound or the poor clearance of higher levels of estrogen, you can get acne. Your androgens can convert to 5-DHT, which is really known for stimulating hair loss in both men and women. So that's where that comes. And then, as mentioned, polycystic ovarian syndrome. So those are some of the side effects of birth control and the side effects of coming off. So now let's get into how we are going to safely prepare a woman's body for coming off birth control. All right, let's get into this protocol now. So number one thing that you want to do is kind of all of this combined. You kind of do this all together. It's kind of like one-step approach. There obviously are intricacies to it and nuances to it, but I'll briefly go over everything and explain. But you really want to make sure that these detox pathways are open, because what will happen is, as mentioned, estrogen can skyrocket, androgens can skyrocket, and then they get stuck. Because many of us are dealing with poor drainage, poor clearance, poor detox pathways, however you want to look at it, lymphatic system, etc. So this is really important that we open up these detox pathways. So now that I'm thinking about it, something that I didn't put in there is lymphatic work. That is crucially important, which I'll comment here in a second. But let's start with, once again, always consult your healthcare professional prior to following any sort of protocol you ever see on the internet, right? Any sort of supplement, always consult a professional first, because there are a lot of things that are marked healthy or good for you that could end up really bad. So we want to make sure that you're safe to do these kind of things so you don't end up worse. Because I myself as a coach have experienced making people significantly ill in the beginning because of missed context and applying these things and not having it go the way you want to go. Where I'm at now, it's like a lot of immune system work and stuff. But that's why I say, if you're going to follow this, make sure you're already in a better state, that you're not having crazy immense allergies or, like I said, gut issues or whichever, or like autoimmune diseases and such. So number one is open the detox pathways. And a really good bang for your buck way to do this is medical foods. So we're going to look at something known as Ultra Clear Renew. What it is a formula design that is boatload of nutrients that supports the detox pathways. You have 3 major detox pathways. How I explain this is, the first one is you're collecting all your kitchen, your bathroom, and your bedroom garbages. So you're taking fat-soluble toxins and making them more water-soluble. Then phase 2 is you are taking that garbage out to the curb. And then phase 3, that is the garbage truck incinerator, however you're exposing of that garbage. Most people struggle with phase 2 and phase 3 due to malabsorption of nutrients, poor methylation, poor lack of fiber, poor bile production, all that kind of stuff. So I'll get a little more into that. But so this one here covers a lot. Now, once again, though, this can really support a specific immune pathway that can make you feel worse if you're already dominant in that. So you want to be careful with these nutrients. Plus, flushing can make you feel like garbage too, because you're pushing everything out. Women are very susceptible to UTIs and bladder infections when they open detox pathways. So you want to be careful, tons of water. If you're someone who experiences a UTI, you can use things like Uva Ursi or Cranberry D-mannose is a safe one. You shouldn't really have any negative side effects there. I have other magical ones to use, but I'm not going to say that in this video. My clients can attest to what I do that is foolproof. But so Ultra Clear Renew is a very, very good product. It's pretty much a whole meal in a shake is what it is. But as mentioned, some people cannot do this. It's either too much for the body or their immune system is too dominant, so they need to use other routes. That's where like glutathione can come in, because glutathione is heavily involved in phase 2 of detoxification. So are B vitamins, but you want them in your methylated forms, okay? A lot of people have genetic SNPs. So if they take non-methylated B vitamins, it actually causes more stress for them. So, but glutathione, I always say liposomal liquid form is a very good way to help improve detoxification. It's one of your body's most powerful antioxidants. It helps with a lot of things. I could do a whole video on that. DIM, indole-3 carbol, calcium D-glucarate. So I'll bring the Dutch test up again. And when we're seeing the Dutch test, I'm not going to go too in depth in this, but we're looking at your E1, your E2, your E3, and then you can see your 16-hydroxy, your 4-hydroxy, and then your 2-hydroxy. Don't let that deter you from this video. Don't worry about the technical terms. Essentially, your E1, E2, E3, that's your bathtub. And then your 16-hydroxy, 4-hydroxy, and 2-hydroxy are your drains into 2-methoxy. So that's where B vitamins come in and methylation. So these guys here are going to help push it down your 2-hydroxy, which you'll see the green pathway. That is your healthy drainage, your healthy estrogen, healthy hormone clearance pathway. If you're sending it down the 16-hydroxy or the 4-hydroxy, those are more inflammatory and cancer proliferating. That's why estrogen can be very cancerous. It's also because estrogen pushes an immune side that doesn't fight cancer. So that's why estrogen leads to so many things. So this is where women who are dabbling with estrogen, hormone replacement therapy, whatever it may be, estrogen is not the devil. It's super important for you. You just need to make sure your immune system is balanced and that your detox pathways are open and you're clearing, okay? So these guys are really good for pushing it down. Good, your healthy pathway 2-hydroxy, calcium D-glucarate is good for lowering your 16-hydroxy, for example. So those are some things you can look into. Ultra Clear Renew contains majority of these to help with that. Flaxseed, we all know a lot of women are familiar with seed cycling. That can be very beneficial. Green veggies, we all know that as well, especially because they contain some of these nutrients. They help. Some people can't eat vegetables though, or tolerate them very well, shall I say, because of gut dysbiosis. Aloe vera juice can really help because it can quell the intestinal inflammation, because that intestinal inflammation can lead to a lot of symptoms, to a lot of gut dysbiosis. So aloe vera juice can really help there. Fiber can be very important. Fiber is very important for phase 3 detoxification. It's how you get it out of the body. That is your garbage truck. As mentioned though, some people can really struggle with fiber. So you have to be careful with the amount of fiber that you are using. So teas can be really good. Things like dandelion, green tea. Burdock root tea is really good as well, because those are going to help clear out the biliary ducts, produce more bile, which is phase 3, liver detox. So that's going to really help finish off the job. And as mentioned, lymphatic work. A lot of people neglect the lymphatic system. Super, super important. It's like the cause of a lot of people's symptoms. We are very, very sedentary. So when you hear like sitting is the new smoking, where that kind of comes from is because you're not moving, you're not contracting muscles, so you're not causing that lymphatic system to flow. Because the lymphatic system isn't like the cardiovascular system. It doesn't have a pump. So it's not going to just magically start moving. You have to move. This is where like no joke, vibration, those machines where you stand on and your butt shakes everywhere, there's actually validity to that. The reason you can't just do that and all will be well in the universe, because there are other steps to the process. And that's where a lot of people miss. So things like lymphatic work get labeled as hocus pocus and a waste of money and time. They're actually amazing, but if you're someone who goes for a lymphatic massage and then you go out for drinks and dinner afterwards, it's not going to be very effective. There's certain things you have to do to make lymphatic work very, very effective. But those are some really good ways to open detox pathways. And we do this because we are going to have a flux in hormones and we need to get them out of the body. That's literally going to negate all of those side effects. So now, reduce CNS activity. I believe every post I've ever made, every video I've ever made is about stress management, because stress is going to affect the thyroid, it's going to affect the adrenals, it's going to cause high levels of cortisol, further impacting the thyroid, creating more gut dysbiosis, destroying methylation. There goes your detoxification process. Methylation is also very important for building hormones. It's not just clearance. It's actually probably more designated to building hormones and neurotransmitters. So you want to make sure your methylation is in check. So this is why reducing CNS activity, so sympathetic dominance to pull yourself out of that and activate a more parasympathetic nervous system, your rest and digest. That is a very important way to stimulate these things, because when you are in that rest and digest, your body goes, oh, okay, we don't need to run from a saber-toothed tiger right now. We can do a little bit of detoxification. But when you're stressed out, your body's like, no. Detoxing is not what's going to get us away from the saber-toothed tiger. So we need to halt on the detox, and we need to allocate all of our nutrients to running away from the saber-toothed tiger. When in today's society, that's probably your significant other yelling at you, or you're late for work, or whatever, or you stubbed your toe, okay? That's how it kind of works. So reducing that, so increasing your vagal tone. So we're looking at things like meditation, breathing exercises. I've gone over this 1,000 times. Meditation does not have to be sitting there humming like a Buddha. Yes, it is effective. Humming vibration of the esophagus helps improve vagal tone. That's literally why Buddhists hum. For example, you can also use TENS machines, TENS, those electrodes. You hook it to your ear and to hear. I actually recently had a podcast, had a guest on, Dr. Rachel Fontaine. She's a very big advocate of vagal tone stimulation. She uses machines like that and whatnot, so you can check her out. I'll take the podcast here and you can check that out. But that's a very good way to reduce CNS activity and improve many other physiological processes. Walking, super important, also supports the lymphatic system. Nature, water, mountains, trees, forests. That is what we were designed to be around. We were not designed to be around all these lights and these big buildings and all this kind of stuff. And people never get out of the city and then they wonder why they never feel well. You got to get out in nature. That is what you were meant to do. You are a human being. Get out in nature, okay? Less screen time. Once again, we weren't meant to be plopped in front of a phone, in front of an iPad, in front of a TV. This is going to activate a lot of sympathetic dominance, deplete a lot of dopamine, which is really important because dopamine is your healthy stress response. Did a whole dopamine series here. I'll tag it. It's super important to have adequate levels of dopamine, because if you don't, you're going to rely more on your adrenals, more on cortisol, more on adrenaline, and more on your thyroid, rendering them ineffective, threatening them. Stay away from those damn screens. Laugh your butt off, okay? That is a crucial thing that I think is missing from today's society. One, we're super desensitized. It's really hard to be funny these days. So it's kind of like more difficult to laugh these days. That's kind of why I always joke. Now then, people don't take you as seriously, unfortunately, but we need to laugh more. Laughing is super, super important. Laughing stimulates vagal tone like you wouldn't believe. How many people have had that laughing fit where they pee their pants or their stomach hurts and their abs hurt and they just feel amazing. I mean, they might be exhausted from laughing so hard, but it's super, super important that you laugh. Watch comedies, not thrillers. Stay away from Jeffrey Dahmer, okay? Watch funny stuff. You need to laugh. Those murder documentaries, by the way, a little tangent, off tangent. A lot of people really want to watch murder documentaries because they're trying to spike dopamine. So laugh more though. Watch more comedy stuff. And then we can look at supplement. I like that on the bottom of the list though, because you could supplement all you want. And if you're not doing like a quarter of these, then you're going to have a hard time still. So supplementing though, you can look at cortisol managers. They contain ashwagandha, they contain Relora, phosphatidylserine, L-theanine, things like that to help lower cortisol levels. You could also look at more technical stuff like Serenogen and Trancor from Metagenics. They can really help calm that central nervous system down. But as mentioned as well, just stimulating that vagal tone. CBD oil, I think, helps stimulate vagal tone. If I remember correctly, it's just a calming effect. Once again, though, it can suppress the immune system. It can lower dopamine, so you have to be careful. Use it under the right context. Vitamin D, omegas, things like that can also help stimulate vagal tone. So now, this is a big topic here. Eat more food. Ladies, you have to eat more food. I understand, though, why women are scared of eating more food. So when I mentioned on the other side there, weight loss resistance from improperly coming off, because when hormones rebound, it's usually estrogen that shoots up. And when you eat more food, if you are not under the right context, as in your thyroid's not optimal, you're suffering from gut dysbiosis, low dopamine, whatever it may be, poor sleeping habits, all those calories are going to go to estrogen. So then you're going to get puffy, water retained, and possibly even fat retention. This is where a lot of women get the illusion that they build a lot of muscle, when in reality what's happening is they're actually filling the muscle out with a lot of minerals, water, electrolytes, glucose, and triglycerides. So then when they go to cut down, they actually really gain a lot of muscle. This happens to men too, but more so women because of lower levels of testosterone. But so you have to make sure everything is in place and hormones are balanced correctly, so you're not just shooting everything to estrogen. This is where the detox pathways are super, super important. But two, like one, you got to increase your nutrients. So we have to get more food in. We have to build hormones. Check out my hormone video. Take it here. It's a long ass series, but that one is more food, dietary fats, cholesterol is what builds hormones. So we need to build progesterone because it's going to be tanked. Progesterone's going to be tanked. We got to build that. We got to build more testosterone. We got to flush estrogen. You need a lot of glucose to detoxify. So if you're somebody who's trying to open detox pathways and you're running keto, it's not going to work. You're going to feel worse long-term. You might feel better because you mask some symptoms by not feeding into inflammation, but you're not opening it up long-term. The liver needs more energy, so it's going to run gluconeogenesis, whether you like it or not. It doesn't matter how much protein you eat, and then you're going to create more inflammation. So you have to eat more food. Plus, it's going to reduce cortisol. They're counter-insulin, cortisol are counteractive. So if you eat food, it should reduce cortisol. This is why they say eat a bolus dose of carbohydrates after a workout, because you want to shift that cortisol response, that sympathetic state, into a parasympathetic state. You can do that with food. You need more food. Now, you may have heard something about reverse dieting. I do not do reverse dieting. I might have made a video, I don't know, so I can't say it, but I think I made a video. I don't do reverse dieting. I take people from 1,500 calories to 2,500 calories, no problem, using a training program, proper supplementation, reducing CNS activity, opening detox pathways, and they don't even gain weight. I have many women that can attest to this. I might force them to comment because women are so scared of eating more food. They're so scared of eating more food. But food is medicine. It is your nutrients. It's not the food's fault if you are poorly reacting. There's an underlying health issue that is occurring that is causing that food to give you the less than desirable results. Also, when people think of more food, last time I ate more food, I got overweight. I'm not talking alcohol and pizza and all that kind of stuff. That's where people's minds, they kind of don't put two and two together. And you may not believe it, but I see it a lot. So when you eat more real food, though, less processed stuff, you're going to get a much better response. But that's where you have to really look at gut dysbiosis, because if you have gut dysbiosis and you have an overgrowth of bacteria, all that quote unquote healthy food is just feeding it. So then that bacteria is creating more toxins, more inflammation, resulting in higher levels of estrogen, resulting in lesser clearance of estrogen, causing weight gain and a bunch of other symptoms that we don't like. So we get scared, women get scared, and they go back to eating only 1,000 calories and never feeling good or achieving the physique that they're looking for. Eat your damn food. I cannot stress that enough. There is a way to eat more food without those undesirable effects, okay? But as mentioned, it's going to really support everything you see on here. Food is medicine. Now we can look at supporting the thyroid. If you're doing all these rather effectively, you probably don't need to support the thyroid via supplementation, because reducing CNS activity means less cortisol, which means improved thyroid. Opening up detox pathways means less neuroendocrine toxins that can affect thyroid function, production, however, binding, etc. That is where that's super important. And then eating more food, reducing cortisol levels, more nutrients to help promote thyroid function. So you probably don't need to supplement. Some people do though. That is one where if you have a woman who's really scared of eating more food, I would go straight to supporting the thyroid, because they're going to improve their metabolism and utilize that food better, kind of keeping them on track instead of getting scared. Yeah, hold on. Let me go into this more. We can do thyroid glandular, but once again, thyroid glandular could be just like a doctor giving you T4. You could have the conversion issue. But if you are doing these things, that conversion issue should improve. So you can get away with some thyroid glandular. You also just may need conversion nutrients, vitamin A, C, D, selenium, iodine, zinc, L-tyrosine, and forskolii. Those are help with the conversion of T4 to T3, improving your metabolism. But some individuals might need T3 medication, so Cytomel. Very difficult to get from your doctor. Once again, only do this under the supervision of a trained professional because one, people get really biased because T3 can like cause a lot of fat loss, but then you're going to wreck things. So don't do it long term. Use it under the proper context. Or two, you could have very high levels of reverse T3 because you are not reducing CNS activity. You are not reducing cortisol by eating more food. You don't have these detox pathways open. So your reverse T3 is through the roof. So this Cytomel, this T3 medication builds up in the blood, causing adrenal issues. Then you get lightheaded, you get dizzy, you get pain, all these kind of things. Consult a professional, but T3 medication could be a viable solution short term for some individuals who are coming off of birth control. But most of the time, because as I mentioned, you want to be under the proper context before removing birth control and taking these steps. These individuals can get away with just thyroid glandular. Most of these nutrients are going to be found in the more food that they are eating, okay? So you can very effectively and safely come off of birth control. I've worked with my majority of my clientele are females, and I have worked with many cases of removing birth control. And I have some pretty recent testimonials, or shall I say feedback recently of coming off birth control and barely experiencing anything. One woman recently was like, I didn't even know my cycle was coming. And that was after removing birth control, both a progesterone and estrogen-based birth control. So this is a very good protocol, Once again, just make sure that you guys are in the right position. Sorry, you ladies are in the right position before implementing these, because as mentioned, you could feel a lot worse. I mean, not here. Everybody do this. Everybody do this. These are safe. These two here, you can do that even if you feel like garbage. If you got extreme gut dysbiosis, it's only going to benefit you. But these two here, you need to take care of the gut dysbiosis before these can really benefit you. This might be part of taking care of that gut dysbiosis, but you have to use it diligently, properly to really benefit you, or you could feel a lot worse. Big, heavy dose of that could put you in the hospital kind of thing. You're going to be fine, right? No damage is going to occur. It's just that there's going to be like a crazy bladder infection probably. They're going to put you on antibiotics and then make everything 10 times worse. So be careful with this stuff, okay? There's so much I could say to this, and especially once I got rolling here, I can go on these tangents and everything, but please don't hesitate. Drop things in the comments. I know many women are out there that are experiencing negative symptoms from birth control, and they've come off and they've never been able to kind of be normal again after coming off of birth control. I actually see that a lot of women will come off birth control, it's been like a year and a half, and they still are suffering with these issues. So don't be afraid to drop in the comments your experiences, how you feel. I can answer any questions, guide you, things like that. But you can literally come off birth control safely, not have the side effects mentioned or that you have read about, and feel great. Then you just have to worry about whether you're having a baby or not. Okay. So, but as mentioned, hopefully soon a male contraceptive will be in the works, and that is the route we can take, and women can live much better lives, because it's pretty much sexist. Not to get political, if that's political, I'm not big on politics, but it is pretty much sexist. Female birth control is pretty much sexist. And ironically enough, how we trash people, or whatever the word, we look down on people who use steroids, for example. It's literally what birth control is. You are literally taking hormones. It's the same thing. And so, but the female body will respond a little differently to these hormones, and men don't really need to take estrogen and progesterone. So, they can if they want. But anyways, here's your protocol. Make sure you're safe to do this. Drop a comment below if you are someone who experiences this, or if you are someone who has done this and this helped you, okay? So if you guys like that video, please hit the like and subscribe button, and follow me on Instagram at that.coach.curtis.